Senator Johnson is next up, then Senator Kane, then Senator Marshall.
Thank you, Mr. Chairman. Appreciate this hearing. Again, it's similar to others we've had where, we're talking about putting a Band-Aid on a dying patient. And so I want to talk a little bit about the root cause. Dr. Cutler is an economist. What would happen if, let's say, buying a car was an entitlement and there were no regulations on what kind of car you would buy? What would the American people do? They'd go out and buy the most expensive car possible, right? Right.
Or expensive cars.
So you'd end up having then put regulations. No, you need certain, if you want this kind of truck. Well, that's what's happened in healthcare. Mr. or Dr. DeJour, whatever, doctor. Sorry, I'm terrible at that. You mentioned excess federal regulation. You said regulatory burdens, Medicare billing requirements. CMS creates a floor. We need increased competition. None of the things we're talking about increases competition. None of the things we're talking about actually reduces regulation. So the root cause of all of this is a third-party payer system. Mr. Benedict, why do independent physicians need to associate with your association? Why do they think they need that?
Without the scaffolding we can provide around them that helps them ease the administrative burden.
It's all about you wouldn't be necessary if it weren't for all these administrative burdens caused by a third-party payer system, really driven by government-run healthcare. So as long as we got this massive government-run healthcare third-party payer system you're not going to change government. You can talk about fee-for-service going to a value-based model. Again, those are just buzzwords. It's not going to reduce the regulatory burden, just like the EMS didn't really fix the paper burden. It made it worse, or it certainly didn't make any improvement. So why aren't we talking about transitioning to something that actually would increase regulation? Why aren't we talking about high-deductible insurance plans that cover the catastrophic events and then bring consumers back into the process? Isn't that the real solution? I don't, Dr. Cutler, what other area of our economy are people participating in that part burning out because of administrative burdens? Not that there aren't administrative burdens in other areas of our economy, but this is kind of unique to healthcare, right?
It is unique to healthcare. It's also the case, while I share many of your sentiments, unfortunately, many people don't use their high-deductible health plan in the appropriate way either.
Well, because we don't require them to. In many healthcare plans, the only deductibles ever paid is like a $10 copay. So again, people don't really care about the cost of the drugs. Again, we have taken the benefit of free market competition out of healthcare. And that's the problem we're dealing with. So again, anything else we're talking about here literally is putting a Band-Aid on a dying patient. I'd like to revive the patient. So I'm seeing a lot of heads agreeing with me. Where's...
I would say the only caveat there would be you could globally attack this issue with value-based approach to contracting, namely global capitation or risk. Because then you actually change behavior. There is responsibility for the costs associated with the care delivered.
But wouldn't you be better off with independent physicians doing that themselves, or a lot more different insurance companies where you actually had true competition? Mr. Bennett, you mentioned the word the market. Where's there a market in healthcare, truthfully?
It's local.
It doesn't really exist. We have a complete failure of a marketplace here. We've got government control, by and large, setting the terms for how the insurance companies operate. And the only thing they've come up in terms of restraining costs are pre-certifications, and we see the damage done by that. But what else is there to control costs? So you're suggesting doing away with that, then Katie bar the door in terms of runaway costs. What is the current dollar value in terms of how much more Americans spend for healthcare versus other countries in the world? But we at least double, right?
Multiples more.
So it's completely broken. So again, why aren't we looking at the root cause of this as opposed to, again, these buzzword solutions that I just don't think would actually work? I mean, I know it's an attempt within a system that's probably going to be impossible to change.
I would only retort, that's really tearing out the entire chassis, and that may be necessary, but along the way, for us to control those costs, there are opportunities for us.
So one final point. In Wisconsin, I think this is occurring, there are doctors who are just dropping out of the system, not taking Medicare and Medicaid patients, and just literally charging cash. And it's unbelievable how first of all, cost-effective it is, like $55 for a half-hour visit, and the doctors love it. I think we ought to start figuring out a way to transition that where doctors are at the top of the treatment pyramid rather than being crushed at the very bottom and become independent again, like it was only a few decades ago. Thank you, Mr. Chairman.
Senator Kane.
Thank you, Mr. Chair. When Senator Johnson started off and said that the problem was the third-party payer system, I thought he was going to go full burn